So on the sidelines, the three big things to look out for if you're worried about a concussion is if they've passed out, if they're having any sort of seizure-like activity, or if they've vomited, then they need to immediately go to the ER. If those things haven't happened, but you're concerned about a concussion, pull them from play and do your evaluation. If there's any sort of worry, I normally recommend just sitting them and continuing to evaluate them throughout the play and into the next day. In the clinic, where our patients would then follow up, we'll take a good history, do our exam, and monitor the patients weekly. We recommend that patients get good, adequate sleep, that they avoid things that might exacerbate their symptoms. And the important thing is that we progress back stepwise. So they are going to return to school first, and then they'll start to return to practice and play. With concussions, there's not a set number of how many until you can no longer practice or play or participate in sports. It's a pretty personal decision because every concussion and every person is different. With every concussion, they may get worse in severity and how long that you're feeling the symptoms for, so that's something to take in mind, as well as what your long-term goals are. Is this a sport you're playing for fun, or is this a career that you're looking into? So these are all factors to take in mind when you're deciding where you're at with any sort of concussion you may get.